So the service portion is an outreach program, and so we have a team of registered nurses and health educators, and we collaborate with a lot of other agencies in the area that help us to bring some other services, and we just guide the individual how to access those healthcare services, basic healthcare services in the area, and how to reach out to those clinics that provide healthcare services to migrant and agricultural workers. That is the big thing with us, is to be sure that we connect the people with those community resources that are already available and ready to go. And then also for us, not only just to talk to the worker, but also ask questions about the families that are here. If there's a wife, if there's children, and what kind of assistance we can also bring to them. And then and how to access those basic health services, including what's the financial responsibility for them, how to go about to receive those services, and how we can assist financially if it's necessary, which is something that we do in our program. And again, we also do a lot of promotion of wellness and prevention. That is one of the things that I do well, I have to say, and my team as well, is to really sell this prevention. Because what we want to be sure is that people understand how are they health-wise, how do they, number one, how they feel, and then we verify that by doing an exam, a mini exam. So we now are very lucky that we have a mobile unit, that we're utilizing our own mobile unit. We used to contract with another agency, and now we have our very own. And so for the last, since 2000, since the last 16 years, I've been doing mini health exams on everyone that I come across, and some of you have participated in those things. And so what we do is just do the very basic healthcare screening. We do total cholesterol, total blood sugar, we do your blood pressure, we provide education, we give vaccinations to many of you, and also lots of education. And then we also reach out if anybody has something else. Then we talk with that person about how to go about those healthcare needs, and then we kind of guide them and connect them with the proper services. Another thing too that we also do is that we take into really seriously about the cultural beliefs and norms of the population that we're dealing with. As a Latina, I know we come up with a lot of ideas and customs, and so we have to work with that, and I'm very respectful of that, and I teach my team, and my team also, we teach each other about how to really take that into consideration and how to utilize those norms to maximize the healthcare care of that individual based on their healthcare beliefs and practices, and that is to us very important. And most of our clients too are from Mexico, so I have taken a really personal point to really learn about the Mexican culture. Was born and raised in Costa Rica, so we have some little bit of differences, and so it's important for me to know those things. And Mexico is extremely traditional, which is good, and those are some things when you're dealing with the population that you have to keep in mind as well. And so things that I have learned and how to deal with the Mexican culture, and learn a lot about their, not just the culture, but also the food and health practices. And as I said, our program is funded by the wine auction and other activities that we do throughout the year. Again, we celebrated 25 years of the event this year. The wine auction has been incredible. The monies that come up that this wine auction brings to our program. And how all those funds are being managed. As I said, the foundation is our fiscal agent, and they guide all the things that happens with, they organize the wine auction, and I also responsible for providing reports to the foundation, and there is two boards that, committees actually, that oversees our work. One is the Service Advisory Committee, which deals directly with the work that I do with the clinical services. And then there is also the Salud Steering Committee, and the Steering Committee takes care of everything that has to do with the wine auction. And that is made up, both committees are made up of industry individuals, principals of the vineyards and the wineries, friends of the industry, and also physicians from our facility. And so that's how those are run. And then there is a responsibility to report to the Tuality Healthcare Foundation of everything that we do, okay? From the philanthropy area and the service area as well. And then of course we have to also answer to our administration at the hospital. So there is a lot of check and balances on everything that we do. And there is a lot of transparency, as I said, of the work that is being done and delivered. One of the things people ask me a lot, and how do people get involved in the service? The service portion is really a lot of word of mouth. We send information to all of you about what our services are when we start in. As a matter of fact, I'm ready to send an email today about letting you know what's going to happen this coming year. And the plans that we have and the programs that we have that we're working on. And our workers too serve as huge ambassadors for us. We have incredible champions of workers who have already been in our program, understand how the program functions, and they pass that information to others. And so we get phone calls from people that want to be involved in our program just by talking to another person. And so we do have an annual enrollment, and that is what we're doing right now. And so what we have done is that we changed a little bit the enrollment. We used to go to the vineyards every year about this time of the year, January, February. We used to just go almost daily visits to enroll everybody. And so we start assessing how to really streamline that process. How can we do it better? And we start also assessing who utilizes the services, meaning who's really using that little card that we gave, because we were giving a little card to every single person that was in the program. So, my team challenged me to really think outside of the box with that, because I was really adamant to say, no, I want everyone to get one of those cards. And so we start really assessing that. And so what we find out is that the card is being used only by those individuals who seek services at the clinics, or they have an encounter with one of the clinics or a provider or a private provider. So instead of giving a card to everyone, because you can participate in the wellness clinics, you can be in the mobile dental clinics without the card. So the card really was mainly for us to keep track of who was receiving primary care and who was going to specialty care. That was the purpose. So what we did is that we assess what has happened in the last 2 years. So we're going back 2 years and see who has utilized those services. So those individuals are the ones who are getting now a letter so that they can re-enroll, because we already have all that data in our database. So now we just mail 600 letters. And we travel throughout the I-5 corridor and 99 on a monthly basis. You will see us somewhere in the valley providing healthcare services. Any questions to this point? Okay. So this is how I function, and this is very technical. This is really nursing. But I just want you to understand this, because this is an important thing for all of us to understand. One of the things with the Salud program is that I took the nursing model to bring it, that occupational health nursing model actually, and work it to make it into outreach services. One of the things as a registered nurse, we learn a lot about acute care, and we learn a lot about, community health, but we don't learn a lot about migrant health. And that has been my challenge and my huge learning experience with this program. It's about migrant health. Migrant health is very, very different than community health. Even though it comes under the same umbrella as public health, community health. And so it served me well to have had my experience in direct patient care in an acute care setting. I did my first 10 years of nursing. I did it in a hospital setting, in the acute care, emergency room, surgical unit, several things. So, and then I had the very fortunate break to go into occupational health. And that's how I was hired. I got hired at Tuality as an occupational health nurse. And so I learned a lot about that realm of healthcare, occupational health, where you go into somebody's business and into a business and you provide outreach, you provide services to their employees. And so that have really been really helpful for me to implement the Salud program, because there is a lot of rules and regulations that come with occupational health, as you already know. So, and when you have a business, remember you have, depends where your business is. When it comes to rules and regulations for our ocean, you have your regular business, which will be the winery, but then you have also the other laws that apply, which is the vineyard, which is agricultural. So you have, and many of you are dealing with the two pieces of the puzzle. Okay, so those are the things that I understand and I know well, and I have shared with all of you, and that's how we run the Salud program today. So as you can see, this model, we have different buckets in our program. So one is the outreach service that I already mentioned to you. And so during these, we have the wellness clinics, and that's when we come to you and we start the wellness clinics. We start in May and we go all the way to October, right before harvest. Because I know harvest is extremely difficult to come to see you. And the last thing you want to see is us coming in the middle of harvest, like let that go away, and I understand that. So we are very sensitive of your job task. I have done a lot of studies, occupational health studies on that, so that I understand when the industry do different things throughout the year. We did a huge study with Oregon Health and Science University on that, on really understanding the tasks that a vineyard worker does throughout the year. And so that really helps me to guide myself on the things that we bring and how often that we bring them. So the outreach services, I say, that's the wellness clinics. That's when we bring our mobile unit, and that's when we do your cholesterol screening, your tetanus vaccinations, because we do those for you. We do the diabetic screenings, and something that we just added on that one is a new test. It's called the A1C. And the reason why we have made such emphasis on these, on the wellness clinics for the cholesterol and the diabetes checks, is because in our culture, in the Latino culture, we have a really high incident of cardiovascular disease. We have really high incident of diabetes. And we have many workers that are diabetic. So we have put a really good emphasis on that. And the good thing is, because of all the years that we've been doing all these testing of these screenings, people are being monitored because we connect them with primary care. And so now they have a home, a medical home that they can go for their everyday checks and their supplies and the nutrition and all of that comes with that diabetes diagnosis. And then the other thing too, with the cardiovascular disease, we tend to have high blood pressure. And unfortunately, that is something that is still plays a role, and stress plays a role in blood pressure and all of that. And we have had a few individuals that had strokes. We had a few workers that had heart attacks, and we have had some people that have passed away due to these healthcare issues. We also screen the height and weight, again, because it's important. All that goes together. And then we also do education on cancer, as I say, the tetanus, and we also do the flu vaccines, which is very important for us to come and vaccinate all of you. So every year I purchase 500 doses of flu vaccines, and they go like that. And that's good because, and this year has been proven really good because there's been a tremendous, horrific flus out there. I mean, and I had people that came to my office this last month, super sick. The one that flew, I said, the vaccine said, I'm sorry, I cannot give it to you because you're so sick right now. We cannot give it to you right now. So, and then we also do vision screenings with the mobile during wellness clinics. And then we also have another program that we send people out to vision centers to have a full exam and glasses if necessary. And then the community social services agencies that come with us, and they provide their information to the workers and all of that. Then the mobile dental clinics is another service that we do, and the mobile dental clinics is free of charge for the individual. We work in collaboration with Medical Teams International and with Pacific University, and that's all this is prevention, the same thing. What I need on that, and that's something that you can really help me tremendously, is to host these two clinics. For Medical Teams International, I need a good parking lot and a place where the dentist can go in and use the facilities and, and wash his hands. And if you have coffee, even better. And so we need that. And we also, the same thing for the Pacific University, the dental hygiene. The dental hygiene, this is made up of mobile chairs. So we need a room. We cannot have those services near machinery. It has to be a nice indoor room where they can set up the chairs and all of that. So many times, and I can show you pictures of us in a tank room near, I mean, it's just amazing what we do around the lab and what have you. We just need to stay away from farm equipment, okay? So those are things that we really need help with in hosting those clinics. A good facility and easy access for others to come. And then the other thing that we're going to have new this year is Pacific University just got a beautiful mobile unit for vision services. So we're hoping to utilize that, and it's going to be the same. We need a good parking lot, and we need a room where they can bring some of the mobile equipment so that they can set up. So those are the really things that I really need help with. The wellness clinics, as I say, now we have our own mobile clinic, and the same thing. I just need a good parking lot, an area where we can set up our tent and our chairs and all that. And I like to stay there at least 4 hours, because then we can invite others to come. But I'm very sensitive, as I say, to your time and energy that it takes, and I don't want to take a lot of time from the workers. And so what I will ask is for you to give us an hour and a half to 2 hours to do those clinics and provide the services to the workers. And all of that is free of charge, by the way. You don't have to pay us anything for those services. Then the other thing that we do for our workers is the financial assistance. And what the financial assistance means is that if we have somebody that has a pending medical bill, let's say that they went to the emergency room or they had some other expense, we can provide guidance to that individual, and we can work with the provider to negotiate payments options, financial assistance, and then we can see how much the person can pay and what we can assist with. We also guide them to the process, the financial assistance at the facility. And so we work with the hospital and we work with the individual to complete those forms and making sure that they haven't completed, that they understand how to ask. And I have to tell you, workers are learning, and now they're teaching others of how to do. Because I get phone calls from champions to say, hey, Leda, so-and-so went to the hospital and I told them to complete financial assistance. I say, great, So the person calls, and then we make sure that they're in the right track. And then we also provide some stipend to the clinics. And that is something, we don't dictate to the clinics what they charge the patients. If somebody goes to, let's say, to Virginia Garcia, to any of the federal qualified health centers, those clinics needs to put that individual in a sliding fee scale based on their income. And that's what the charge are for that individual. And so, but we turn around and we provide another fee to that clinic if they, for each patient that goes to the clinic receives a stipend from us, from our program. And that helps the patient and helps the clinic as well. So it's kind of helping each other. The other thing that we do, which is huge, is case management. And case management in the healthcare meaning is what I just said, guiding that individual. Like I have right now, I have 32 cases on my queue right now of people that we are guiding, just me alone, that I'm just helping with healthcare issues. My other nurse, she has, I don't know, probably 20 cases that she's following as well. And so right now I have, to give you an example, I have an individual who's been having a lot of abdominal issues. There's suspicion probably something going on with her GI, so she's going to have a colonoscopy and an endoscopy. So we're helping her to guide to her. I have another person who has a horrific impacted wisdom teeth, and he has surgery coming up later on this month. But just helping them to get the provider, to make the appointment, to find out how much it's going to cost, and arrange all of those things. We have individuals that are dealing with cancer right now, and then we are helping them with the guidance. So all of that is what we call case management. It's all that referral, all that help that we give to the patient in collaboration with the primary doctor as well. Because many times the clinics have some limitations, and so they will say, call Salud and they can help you with other things. So, and there's other programs in the Portland area and here in the Valley that we can access when someone has no insurance to help with some of these, especially for seeing a specialty and also for financial assistance. Then we also do the community collaboration, and that is working with all the federal qualified health centers, with the clinics, with social services. We are really in connection with the Oregon Food Bank and all the sites in the area, because we see that after harvest, when there's no more work, a lot of families have great needs. So we connect them they know where to go, and we provide that information to them. And then the occupational health and safety. That's the other thing that I offer to the industry. And so one of the things that we do on a regular basis is the Medic First Aid or CPR classes. So I was looking at the information, and we started this program in 1999, the Medic First Aid and CPR classes. So we have the most trained individuals, really, industry. You guys should be very proud, because every year we train probably anywhere between 100 to 140, 160 people on an annual basis. That's incredible. So you really have a very good track record of the people that are certified in Medic First Aid. And so that is a 2-year certification that we do the classes, and actually we're going to have them here. We're arranging right now the schedules for coming March and April of this year. That's when we're going to do the classes here at this facility. And so that is something that I do for you guys. At one point, I was doing a lot of, on a regular basis, I was doing the pesticide safety training, but that's a lot of changes have occurred with that. And so now I'm just collaborating with other agencies, and if you have any questions with that, I just give you guidance of where to go. Our team is pretty lean right now, so it's kind of, we have to pick what kind of things we can teach. And but I do have a lot of information about ergonomics and back safety. That's another thing that I got very involved. And then the other program that I got really involved was the pesticide safety training and the applicator exam. I work with OHSU, with the Center for Toxicology and Research, and the state to work on the Spanish book for that particular training. And I understand, I believe now Oregon has it. And so we were trying to see how we were trying to understand what were the barriers for workers, because a lot of our Spanish-speaking applicators, they have a hard time passing that exam, the applicator exam. So we were trying to understand what were those barriers. And I think, so out of that study, a lot of good things came out of that study. particular about math, that we need to be sure that the person understands math, that they know how to use a calculator. Just simple things that we discover on that study that I think it has helped to better that training. I know that Letty teaches some of those courses too. And so those are the things that we do for you guys, that we offer some of this training. The one that is now a regular is the medic first aid and CPR, and so that is something that we're doing on a regular basis. And the other ones, we just come over and help you or send you or connect you with somebody that can do that training. The one thing that I highly recommend, the pesticide safety training, it is something that is being done. The Oregon Last Center is doing an excellent job with that. And Armando, who was our health educator, I was preparing him to do that. Unfortunately, he moved to another position. So I need to start anew to see how we're going to provide that service, because it's a very good training, and we do it in Spanish, and also the Oregon Last Center can help us and do it in an indigenous language if you need to. They have it in I'm going blank now. Anyway, I have to get back. I'm going blank. What was the name of not Zapoteco, but the other one, Mixteco. They have the training in Mixteco, which is very helpful for some individuals. That Spanish is not their primary language, because that's another thing that we come across, is that we have a lot of indigenous workers that we have to be aware of, because we cannot just assume that they speak Spanish, because many of them do not. And so we have to be very careful, particularly when we give them vaccinations, that the person understands their consent really well and understand the information that we give them. And so in a nutshell, this is really what our program is all about. The other thing too that we are going to do this year is that I've seen a lot of changes in the industry. We've seen changes in the, at least I have seen a lot of changes in the industry, how it's growing, the number of workers and all of that. And then also I'm seeing more contractors coming into play. So I need to have a better understanding of how that works in the industry. So I'm going to be doing a small survey this year to gather information from all of you, so that I could have a better understanding and we can provide better service to those workers and to all of you. And so this is my contact information. We are around year-round. Our program is not just one time of the year. We are in business 12 months of the year. January or December, right after flu vaccines, towards the end of November and the month of December, we use that time to really catch up with our reports and just to see all the things that we need to do to provide information to our boards and our service advisory committees and all of that. And then we use also that time to prepare the forms, revise everything, and start the year again. So we are ready to go. We are in the process, as I said, we just email or mail a lot of the enrollment forms. We have, if you need enrollment forms for some of the workers, all you need to do is give us a call, and we just mail some to you. I prefer for us to mail them to you than to make copies, because sometimes the copies kind of get all messed up. So I prefer to mail them to you, or if you prefer for us to come in person and explain to the individuals how the program works, that's also another option for all of us. The one thing too, the other thing that we're doing is the mobile dental service. That's also year-round. One things that we did, because that's such a high demand of services. So what we're doing now with those is that we collect cell phones, and we collect the service that person has in their cell phone, and so we send in texts directly to areas. So we isolate who lives in McMinnville, who lives in Dayton, who lives, and then we mass text we're having a mobile dental clinic, and let me tell you, that clinic is filled in 5 minutes. That fast, people respond, or in 10 minutes. One of the things that I do want to ask also for help is during the mobile dental clinics, particularly with both, mainly for Medical Teams International, is that the individual, as I say, that is free of charge to the patient. We pay directly to the agency for those services. So the one thing that I request and I ask the worker is, number one, to ask permission, because many times they wait until the last minute and they cancel the appointments. And so we cannot have an empty slot on those clinics. We have to have someone in that chair. And so we are selling really and passing the information and training the individual that if you're not going to make it, let us know ahead of time. And so if you know that somebody is coming to has an appointment with a mobile dental, just please help that individual to get there, because we just don't want the dentist to be without a patient. Okay, so that's one of the things that we do. And then also, as I said, with the mobile dental, with Pacific University, that is strictly hygiene, dental hygiene. All they do is exams and cleanings all day long. We can see up to 14 patients, sometimes 16 patients on one day, and that's all they do, just cleaning. The Medical Teams International, that is for extractions and fillings as well. So it's treatment. So there's two different things. So we have a big waiting list of people that needs a lot of dental issue. So our program, again, the funds that we gather from the wine auction, all those funds pay for our program, including the teams, everything in the department, and we are very really take good care of those funds, because we know that those are donated funds, and we are extremely responsible on making sure that those funds are being utilized to the max and in a good way.